So hi everyone. I think I know most of you. I'm Felicia. I just got my LMHC 2 weeks ago, which is very exciting. And so I'm glad I can put those letters on my little slide. And I also have my Master of Arts in Counseling and Depth Psych from Pacifica. I did run a depth psych training a while back. Some of you were at. And this is an intro to couples therapy. I'm really hoping that this training will give everybody confidence to start seeing couples if you want to, or even try to see one couple. The thing about couples therapy is it is so complex and there's so many moving parts to it that I was thinking, like, okay, I don't want to just tell any clinician out there, just try to see a couple until you know some basic things. And so that's everything that I tried to put in this training is everything I would want you to know before you tried to see a couple and to have some confidence going into that. I think we all learn in grad school what not to do as a new therapist, but I don't think any of us learn. I certainly didn't what not to do and what to do as a couples therapist. So I'm going to be talking a lot about that. Importantly, how to structure the early sessions and ask the right questions. Structuring the sessions is really important, as you're going to hear about. And so having a game plan going into the first sessions is really helpful. And that's what I hope to give you. Going to talk about the different case formulations, Azelle, like you were talking about, the people who are avoidant, who are fighting all the time, who are passive aggressive, all of that. So we'll talk about how to approach different couples because there are different ways to do it. Hopefully, even if you're not going to start seeing couples after this, you'll also learn something that could help you with your individual clients. I'm sure that a lot of this could be applicable. After I talk about the theoretical background and some of these early things, I'll pause and let people ask questions, and then I'm going to talk about more stuff, and then we'll do a whole Q&A and discussion at the end. So I found out I wanted to work with couples because I was in my internship at CFS in Hyannis, working with mostly children and teenagers, but I did have one adult client and he would just talk about his marriage. He had a little boy coming in to see a different therapist while I saw him. And I realized that was the only session in my week that I was really looking forward to was this guy talking about his marriage and his marital issues. And that kind of tracked because I've always been really into talking to people about their love lives, their dating lives. My friends have always called me up to talk about relationship problems. I've also been I'm a prying person, so I generally tend to like to hear what's not going well in people's relationships, not because I want to focus on the negative, but because I feel like that's how you get to know someone better is if you can get past the facade of everything being perfect because no one's relationships are perfect. So I've always been interested, but I really realized that I wanted to work with couples with that one client. So I'm very grateful that I had him. I started when I got out of grad school working at the Couple Center of the Pioneer Valley. The Couple Center trained me and they operate under the Couples Institute, which is a humongous training group, probably one of the bigger ones other than Gottman, at least in the US. That was the model that I learned under. It's called the developmental model. I'm really grateful to the Couple Center for teaching me so much. A lot of what you're going to hear me talk about today, it's not exactly what they taught me, but it's based on what they taught me because they taught me all of these things and then I learned after 3 years my own spin on it. But I just wanted to plug them because I wouldn't be able to run this training if it weren't for them. And also, if you have clients that need couples therapy, you should send them there because they do telehealth. So at this point, I've sat with couples for thousands of hours, which is nuts to say, but it's true. That's what I'm coming in with. That's where my knowledge is coming from. I'm pivoting a little bit into matchmaking, dating coaching, more so than couples work, actually. There are a lot of reasons for that. I really enjoy the early stages of relationships, I realized. I like learning about couples in the later stages, but I do think that's helping inform my matchmaking and some of the dating coaching stuff that I'm doing now. There's an obvious thread here, but I'm more focused these days on learning how to do matchmaking and dating coaching really well. With that being said, I've learned so much, and if I do keep tapering down how many couples I'm seeing, I do want to pass the baton. So hopefully, if one person comes out of this training and starts wanting to see couples, I think that will be nice and I will have done my job. Oh, and I like to pepper my slideshows with memes to keep things spicy. There's some key differences between couples and individuals. You are no longer just working with one person. Your unit of treatment is the relationship. That changes everything. From one to two is a huge shift. The biggest difference, I would say, is that you really can't be a blank slate. You can't be passive. You can't just let them go off. In individual therapy, there's some of that. You always want to be engaged and stuff. But with individual clients, which I've also seen a lot of, I've noticed that if they want to go off, you can let them and they'll probably process something and maybe it'll be good for them to just go off. That is the biggest difference, I would say, between individuals and couples is you really don't want to let them go off. Unless, we'll talk about it, but unless they're a couple that never goes off, you're going to be directive. And I think a lot of people get scared of that. I want to help you not be because it's not like you're bossing them around, telling them what to do. You think you know better than them. It's none of that. When we're in therapy school, they really teach us not to bring our own agenda into the room because obviously you're there for the clients. But with couples therapy, it's very different because they really need your help to contain it. And in order to do that, you do have to be a little bossy sometimes, especially with people who are going to go off the rails, which you will get. So I want you to feel confident in being a little bossy as a couples therapist. And it's not because you think you know better or you know what's best for them. It's because basic skills that they need help with, and you're going to help them learn it. I'm really not a behavior therapist. Like anyone who knows me and is in supervision with me knows that I think about things from a very depthy perspective. And I don't really approach therapy in terms of behavior change and homework and all of that stuff. But it's just interesting because with couples, it feels like a non-negotiable that you need to do that. And so it's just part of it. I've really leaned into that and I like it because I'm also a very opinionated person. And so I think it's nice to be in a structure where I was basically, when I was trained at the couple center, given permission to share my opinions. Obviously, the opinions are rooted in theory and experience, but also the couple wants to hear them a lot of the time. The alliance and the rapport, which are really important in individual therapy too, are extremely important in couples therapy. And you have to do it with both partners. We're going to talk about how to do that. How do you maintain an alliance and a rapport with two people at one time, and especially two people who aren't necessarily getting along with each other? There's a bigger distinction in couples therapy between process and content, which is really just a big hack for you. If you feel like you're starting to work with a couple and things are leaning into content a lot, which often they do, they're bickering about whatever, they're fixated on a fight that they had and what this person said. It's really nice as a therapist to remember that you can always zoom out and look at the process of what's happening and work with that. And the content is, in many cases, not relevant. In certain cases, like infidelity, the content does matter, but for the most part, especially in early sessions, focusing on process and helping them focus on process is huge. Again, you want to be directive in that you're giving them homework assignments and tasks. I think that the time between sessions with couples is more important in some ways than when an individual goes off and doesn't see you for a week or two, because the couple is just going to continue being with each other, often in the same home, interacting. And so giving them strategies and really tasks to check off that they know that they're doing something to work on their relationship. It's nice and it's something that you can check in with them about, and it's a gauge of how they're doing, if they're doing their homework or not. The reason that I really wanted to run this training and give y'all these tools is because I do think, and this is based on my own personal experience too, that there's a little bit of a greater potential for harm working with couples and going in without a game plan. And it's really not to scare anybody. It's more to actually not scare you. It's to say, here's what I feel like could be harmful if you're just going to go in willy-nilly and work with a couple. And please don't do that and do these other things instead. And I'll give you like a zillion other things to do. But The reason that the potential for harm is greater is because I'm thinking a lot about the hostile couples that are fighting and often have kids. And if you allow them to come into your office and just continue the patterns that they're in, that can really unearth a lot. And then you're sending them back out into the world after having unearthed all of these things. And so it's like with an individual client, you wouldn't just jump into their deepest, darkest trauma. But with couples, it gets out of hand way faster. That's just something to remember. There's a reason why you're being directive and holding a frame. And like my personal experience with couples therapy, because I went once with my husband 2 years ago. And I should have just gone to someone who was trained in the developmental model, but I didn't. I just found someone on Psychology Today who said he took couples, which I think a lot of people do. And maybe sometimes that works out. But we were fighting a lot at the time. And it was really bad. Actually, I realized we were worse off at the end of the whatever 4 sessions we had with that couples therapist than we were at the beginning because he had no skill in holding the container. And that happens all the time. I just often hear from couples what their experiences were with their previous therapists. And so that's really why I'm saying it is with a couple, you just have less control if you don't have control. Suddenly you're in the red zone and you don't even know how you got there. That's why the potential for harm is a little greater. But it's also why the potential, I feel like, for helping them and seeing progress is also greater in a lot of ways. So, on that, you're doing a few different roles as a couples therapist, which I really like because I like to wear different hats in every situation. You're doing psychoed, you're teaching them, you're directing, you're like, you talk now, you talk now. And you're doing all your normal therapist things like being empathic and connecting with them and showing them that you care and understand them. So it's more active, I would say. The boundaries and the expectations need to be crystal clear. And we'll talk more about what that looks like. I would be curious as I'm talking about this for you to all notice what your bodies are doing as I'm talking about it, because I have a feeling the way I'm describing it, it maybe is causing some level of anxiety. And I don't want it to, but that's just like interesting to notice. That's just my little plug to, yeah, notice where in this presentation you're feeling like you're getting a little bit more activated. This slide is a little bit repetitive of what I said in the last one. Having that strong presence, being a strong leader, that's relieving to a couple. And that's something that made me feel more confident going in and being directive is that when a couple has been in conflict, often for many years before they come and see you, they want someone to tell them what to do, actually. It's like a kid that doesn't have a lot of structure at home and finally they get in the proximity of a coach or a teacher or somebody who doesn't deal with their BS, but is also still like a strong and loving presence. And it's all out of support. That's a relief for a kid. And we're going to talk about this, but your couple is like a kid. The relationship itself is like a kid. That's the base of this entire model that I was trained under. And so keep that in mind. It's not a bad thing to be directive because it's a relief to them a lot of the time because they don't know what to do. They're stuck. Even if they're a therapist, they don't know what to do. Even if they're an expert in relationships, sometimes they're not going to know what to do. So you can put on that hat of, I know what to do here in some ways. And then that's a relief. They can exhale and be like, oh, okay, that therapist has got us. And on that note, it wasn't until probably a year into seeing couples that I actually genuinely felt that level of confidence that I was portraying. That was a trip to have the people who were training me telling me to fake it till I made it. And I think we all probably had to do that on some level when we first started seeing clients. But this feels a little bit more performative, I will say. Like I was faking it, and maybe some of the couples early on could see through that. But I think for the most part, it was still a relief to them that I was trying to portray some level of confidence. It's probably not good advice in every situation, but fake it till you make it was really good advice in couples therapy for me. Like I said, the coaching is also like cheerleading. You're telling them what to do to better them, but then you're also cheering them on, just like you are with your individual clients. You're telling them what they're doing right. And I love being a cheerleader for relationships. That's why I started all this in the first place. I'm sure a lot of you do too. It's so fun when people fall in love and are doing well. That's the easy part, is being the cheerleader. The biggest thing that you need to get used to is that you're going to be interrupting a lot, and you're going to be pointing out what you're seeing process wise in more blatant ways. And so that's your couples therapist hat. And then you can take that off and go see your individual client next and go back to not interrupting them. But with couples, you have to expect that you're going to have to sometimes. And like, it's not at its core that different when you're in the therapy space. You're still trying to do all of these things, but you're also trying to teach them to do all of these things, like be empathic and reflectively listen and ask deepening questions to each other. You're being a therapist and also teaching them how to do some of the skills that you're doing every day as a therapist. And there are a lot of tools and techniques you can use to do that. Exuding I have a plan energy, even if you don't. You're not going to let things get out of control. This is the best way to frame it, is they come in for a session and you're telling them what to expect from you. You're saying, I don't want things to get out of control. I want to interrupt your pattern. And that means I'm going to have to be directive. So you're explaining to them why you're doing that. There are tried and true ways, which is a really nice thing about the first 1 to 3 to 4 sessions. This will help you be confident going in because you'll have a game plan. And so we're going to talk about what that looks like. And you can tell them that from the beginning as well. These first few sessions, I have a plan of what we're going to do, and this is what I do in the first few sessions. So again, it's a sigh of relief. They're like, okay, we know what we're doing for the next 3 weeks. We're not just going in and having to answer, how are you feeling today? You're going to help them learn the skills that they need to learn. This is the part of wearing the couples therapy hat that I felt the most uncomfortable with in the beginning. I think because, first of all, I wasn't totally confident that I knew how to teach them these skills, but I don't really like when you're teaching and psychoeducating. Sometimes it can come off as patronizing. I think that there's probably some people who can do it really well, but I don't personally like being educated. That was why I had a particular issue with that piece of this role, because I came in with that and I was hesitant about it. Now I feel more comfortable because I've found my own style of how to teach them skills without it being patronizing. This goes for everybody, because I have a couple right now that I'm thinking about where one of the partners is a therapist, and I was saying something in one of the early sessions, teaching them some skill, and I could tell that she didn't want to hear it because she's a therapist. Fair enough. But you still do have some stuff to teach them, even if they're trained in this field. So I think that's just worth noting. Like, you can feel confident that you can teach them some skills, and they do need to learn them. Your goal as a coach is to help them be a better team. So I really like the coaching analogy, because this is like a team that you're trying to lead to the finales or whatever. And so remembering that is your stance as a coach and a leader, that's helpful for you. With containment comes certain structural things that really helped me from the get-go. At the couple center, they did 75-minute sessions. Occasionally, you would get a couple that couldn't afford the 75-minute session. And so I did get 1 or 2 couples that were 50-minute couples. And the difference is really glaring when you don't have enough time to contain. So doing at least 65 minutes is a good baseline, but 75 is it's a great starting point. And there are a lot of reasons for that. Sometimes you're going to want to break it up and see one of them and then the other one if they're super high conflict. So you'll have enough time for that in a 75-minute chunk. And you can relax as a therapist, it's like how I wanted to make this training 3 hours instead of two. Is if there was a blip with the Zoom meeting or whatever, I could still relax and not be like, oh God, am I going to be able to get everything done? It's the same thing. Having a bigger container makes your job as the containment easier. You don't always end up using all 75 minutes to the last minute, especially with certain couples, but starting out that way is helpful. And I don't know exactly how to tell you to do that in a logistical way because I know, especially at Beacon, we have struggled with the structure of sessions and billing and all of that. So I don't really have a perfect answer for what that looks like billing wise, but I just know what works process wise. In that container, you can start and end sessions in predictable ways. For example, these are just a few examples, appreciations of the last week or 2 weeks. To start the session there is always nice to start on a high note instead of just letting them jump right into whatever went wrong. To really push people who aren't wanting to appreciate each other to appreciate one thing that did happen in the last week or two. That's a great way to start sessions. I have these Esther Perel couples cards, which I'll talk more about. I like to end sessions on those, especially if we have enough time. The goals and the tasks for the week are also a good way to start and end because you can be like, how did your goals go? What are your goals next time? When things do begin to go off track, which is it's just going to happen as a couples therapist, and it happens as an individual therapist too, but it will happen probably more often as a couples therapist. And the best thing that you can do is just stop the entire situation. That's probably a good hack for y'all as new couples therapists is you don't have to know exactly how to spin the thing that's going off track back onto the track. Actually, you don't have to get it back onto a track. You could just stop it entirely, stop the train and regulate. And that's what we'll talk about too. So you don't really need to be super skilled in getting them back on track as long as you can stop it when things go off track. That should give you a little bit more confidence because anyone can stop the situation, right? You are going to need to be able to ease back into something, but that's just good to know. Is like containment can just be like, all right, that's done. That conversation is done for right now, and we're going to pivot and regulate. Regulation is part of containment and they go hand in hand. And it helps you as a therapist to always be remembering that because you need to regulate as well and you can model it for them. Sometimes containment is ending early or separating them, saying, okay, I'm going to meet with you for 30 minutes and you for 30 minutes and we'll come together at the end. There's all different ways to contain it. I think you'll know when you're with a couple that you need to separate sometimes just because it's impossible for you to contain it with them together. And that's how you know that you need to separate them apart. And the other thing about containment is that it continues into the week. If you're working with a high conflict couple that's always getting in fights, it is good to encourage them to not continue whatever conversation they were having in therapy outside of therapy, which sounds weird. That sounds weird because it's avoid this thing. Maybe it sounds like that. But it's just in the beginning and it's just until they learn the skills to do it themselves because you don't want to send them out into the world in the middle of an argument that could then leak into then their kids see them fighting and this and that and they don't have the skills to do it well and they don't have you there facilitating it. So especially with the high conflict couples, containment can just mean like, all right, we're going to pick this up next week, please don't talk about this, and it's okay to say that. Containment is really about process. When things get too content focused, it can feel really hard to contain. And so that's something to remember is if you're sitting there and you're having trouble containing, which is not like that's going to happen, you need that to happen to learn how to do all this. You should look at, okay, is this really too focused on content right now? Because it's a lot easier to contain when you're more focused on process. This is related, the window of tolerance. It's been said in lots of individual therapy trainings that when you're feeling something in your body, they are too. I would say yes, I notice what I'm feeling in my body a lot with my individual clients, but it's tenfold with couples. And that's great because it's information for you to learn what you need to do next. And so if you're feeling something in your body, they 100% are as well. And that can be a tool for you. You might start dissociating, being unable to focus on what they're saying. You might get really activated, find yourself getting angry or anxious. All like really good information. You're picking up on something that's in the room. Confusion is like a big one. Or if you're just feeling disengaged from the situation, which those two can go hand in hand, like being confused and then being like, I can't even follow this right now. And then you start imagining what you're having for dinner. That's a huge tell that this is what one or both of them is experiencing. It is confusing being in a relationship, and it is confusing when you focus on content because there's just endless content. You being confused and disengaged is a really important thing to notice. Often I tell them exactly how I'm feeling, not because I'm self-disclosing with no motive, but because the motive is they need to know how I'm feeling so they can know what I might be mirroring from them. And a lot of the time, they feel really seen when you name how you're feeling because, again, they're feeling the same thing. So, regulation is for both you and the couple. Stopping the train, like I was saying, that comes with resetting and whatever that might look like. I will say I'm not, we're in a somatic institute right now. I am not the most somatic person. And there's lots of people in this training who are a lot more somatic than me and would probably be a lot better at this than I am. But I've even needed to learn how to get two people to breathe deeply and notice when one person isn't and really encourage them to do so because this is just such activating work that you need those tools. And we all have some of them, like the grounding in your chair and whatever meditations and breathing exercises and fidgets and art, even all kinds of things to regulate. Use your favorites with your couple and really guide them in regulating because it's the biggest thing. They need to regulate in order to communicate well. And if they can't communicate well, it's often because one or both of them is too activated too. So you can model it for them, the self-regulation, and narrate your own process. Like, I'm feeling a lot of anxiety as I hear you guys talk about how your kids were acting this week. And where are you feeling that? I'm feeling it in my chest. Where are you feeling it? It's slow. It's slow and it's needed, but they might get impatient about it. I see so many people in couples therapy getting impatient because they want to talk about how their kids acted this week and how he's a bad parent. And you're like, can you focus on your breath? And it's annoying to them, I think sometimes, but you gotta still do it, even though it's annoying, because it's like a prerequisite to anything good happening after. And so that's why psychoed is really important about the window of tolerance and all of that. I don't go super into depth about how I do that in this presentation because I feel like there's just so many tools out there that we've all been exposed to or need to be exposed to help regulate. So I'm not exactly telling you how to do that. It's just that it's important. The way that you can practice it that I will tell you about is communication exercises. And those are really regulation exercises. They go hand in hand. Okay. I sort of want to, I have a Q&A slide in 3 slides, but I almost want to pause there because I've said a lot already and see what people are feeling and thinking, or if there's anything that I've said already that people have questions about.
And feel free if you do have a question, feel free. You can come on to the screen or you can just ask in the chat section and I can read them off.
And if you don't, that's cool too. But I just didn't want to be like spewing endless information.
Oh, I do have one question. This
Yeah.
is about the couples therapy show. Are the sessions very similar to the couples therapy show? I'm not sure if you have seen
Yeah,
that.
I've seen
There's
it.
there's
Yeah.
a couple. Okay, perfect. Is it similar to that?
I would say it is similar in certain ways when I do it, but Orna, who's the couples therapist in that show, is really skilled in something that I think we all could benefit from being really skilled at, which is that she is a super strong container without doing all of the things that I'm saying you can do to be a super strong container. She just is one. And I think that comes with time. Like she's been doing it for so many years and she's psychoanalytically trained, which is really cool. I will say she makes it look easier than it is to contain a couple. And so that's like my feedback on the couples therapy show is she's amazing. And yes, learn everything you can from her. And the fact that she's not starting and ending her session with particular skills or necessarily doing all the things that I say, it's not exactly super easy to do what she does. And that's why she's such a skilled therapist and why it's so fun to watch her. But she is
Yes.
containing, whether you know it or not, she's being a really strong container.
Jennifer just said she trained at NYU. Yay.
Yeah.
I know watching that show, sometimes I get anxiety
Oh,
for like,
yeah.
whoa.
It's so funny. I used to watch that show for pleasure the first year that I was a couples therapist, and then I just can't even watch it anymore. I would love to because I like to see her, but I don't need more of that content at the end of the day.
Yes. Before we continue, do we have any other questions for Felicia?
What are you seeing when it's not appropriate to interrupt one or both members of a couple who are expressing strong emotional content? Dylan, can you say more? I don't totally understand your question.
Yeah, I guess obviously there are times where you have to stop and focus on process and do the containment thing. And like you're saying, we're not going to get into that right now. But are there times where you don't do that and you go, oh, this is really important? These
Yeah.
people need to express some things right now. And how do you know when this is beyond? Like, where's the threshold? What are you looking for? That kind of thing.
Yeah, okay. That's a really good question. So I have a couple right now. I share this client with Allison, who the guy in the couple just lost his sister and is in acute grief from that. And that sort of overwrites everything that I'm saying in a way. Not everything, a lot of what I'm saying about content, because with someone who is grieving something so major, I think you do have to just pivot to let them tell you what they need. It would probably relate to crisis. I'm also thinking about a couple that you have, Dylan, where every day is a crisis because we've talked so much about them in supervision. And so you do have to learn also when that's their defense and when that's their excuse. And obviously you know that because you've been working with them forever, but I think that the grief example is a really good one because that's just something that's so major that it almost like overtakes whatever agenda you had as a therapist going into it. Is that helpful?
Yeah, that kind of thing seems like maybe a more particular outlier where someone's grieving something maybe outside of the relationship or I don't know, something else is going on. But even inside the relationship, when two people are expressing strong emotion about one another or stuff that, comes up, like, where do you know? Because I'm guessing at some point it's probably important for them to hear and be able to, I don't know, maybe get better at expressing that emotion. Sometimes it's, I don't know, am I letting this go too far here? How much of this needs to be
Yeah,
said? Yeah.
there's not a great one answer for that because every couple is so different. I feel like we're going to talk about the difference between the hostile couples and the conflict avoidant ones. And with the conflict avoidant ones, I do let them go on a lot longer because it's such a different pattern that they're getting into just expressing something versus a hostile couple. So much more containment and process is needed because it can just go off the rails so much faster. So I think like it is related to what they're saying. If they're starting to like name call, if they're starting to do any of the various things that you could do that would make things unproductive, then you start to know that you need to really slow it down. But you bring up a really good point, which is, yeah, some of it is just letting them communicate. With the hostile couples, it's a lot harder, like the question that you're asking, because you really do have to hold it, and they're not going to get out everything that they want to say because they don't know how
Yeah.
to do it without hurting each other.
That's part of the thing is I want to encourage them to practice doing that, but they're inevitably gonna mess it up. Say
Mhm.
things that are like, okay, you didn't have to go that far. I'm trying to figure out how to not be stifling and encourage, yeah, try to say something when you also you're going off the rails. And if I let them, they'll keep going. So figuring out when to interrupt and when to kind of rein that in or when to let them try a little more and get it wrong and then explain themselves or whatever. It is difficult, but yeah.
Yeah, I think with those couples that they don't have any skill and you tell them to give each other an appreciation and they somehow still end up insulting each other, there's definitely couples like that.
Yeah, yeah.
And those ones, I will say, it sucks that you have to keep interrupting them, but you do have to keep interrupting them. You really can't just let them go because it's a very slippery slope.
Okay, so maybe there's a part of it that's just really being overtly clear. I'm going to interrupt you constantly because you guys don't know how to do this, right?
Yeah, and I'm not saying that's always fun either, but it's better than them just being in front of you insulting each other or making things worse.
Okay, thanks.
Yeah. Okay. So if no one else has anything right now, I'll go back to my slides and then we'll pause again after I talk about the initial sessions and we can talk about those too.
Yeah, you're good to go. I don't see any additional questions.
Okay, great. Let's talk about the intake session. Sometimes you have somebody like come to you. It's usually one person emailing, right, asking for couples therapy, but you never want to only see that one person in an intake session. You always want to see the couple together. And sometimes they'll be like, oh, this person isn't available that day. Can I just do it? No, you have to see the couple together the first time you see them. And you could do a consult with one, but even that, it's good to do a consult with both. And I will say with consultations, I've always struggled with the 15-minute consultation with couples. I would rather do an intake session, a full intake session, and tell them at the end of it that I feel like I'm not a good fit than to try to do a 15-minute consultation with a couple. It depends on the couple. Sometimes it'll be fine, but that's a little bit of a warning. Maybe you're better off doing an intake and then giving them proper referrals at the end of it. I always start with how they're feeling about being in couples therapy because often you'll get that they're nervous or they're excited or they're dreading it. With that question comes the previous experiences they've had, which many couples have had actually. I do that with my individual clients too. A lot of you probably do as well. It's really interesting to hear why that didn't work out. How did it go? What felt helpful? What didn't feel helpful? It's also a nice way to ease in to a session. You're listening for stuff as they're talking about. I often hear previous experiences like I've described where the therapist maybe wasn't the greatest container, maybe the therapist took one person's side, or maybe their previous couples therapist was really helpful and they learned all these things and then they've been out of it for a couple years. So it's just good to hear how that went, how each of them felt about it. You want to know, is one of them pushing to be in couples therapy or are they both really bought into being there? Often it's one partner's idea. That's not uncommon, but if one partner is really not wanting to be there, that's a really good thing to assess for early on because that's going to matter. So you want to know who got us here. Then I jump into here's how the session's going to go. Put on your little directing cap. The way that this works, this is how I was trained. Obviously, you could come up with your own like paradigm for first sessions and maybe it's better than this, but this is what I do. I stick with it because I like it. And there's a few reasons why I like this. You are going to let one person go first. So this is exactly how I say it to them. One of you is going to go first, and I'm going to ask you a few questions. And your partner is just going to sit there silently and not interrupt. I'll ask you these questions, I'll ask you follow-ups. It might take 20 minutes. And then I'm going to switch to the other partner. And then you're going to sit there silently. And then I'm going to ask the other partner the same questions and hear their narrative about it. So you give them a frame for what's about to happen. And you tell them, don't interrupt each other, don't butt in. And this is really interesting because couples have all different ways of handling that. Sometimes perfectly fine. Like they have no desire to butt in, they aren't even making faces as the other person talks. But often it's really hard for them to do that, and that's information for you. What's always interesting to me is, yeah, there's the ones that want to interrupt and you have to remind them. It's perfect for the first session because you're already showing them, like, I gave you a task and I'm going to redirect you if you're not doing the task, right? Someone's butting in when it's their partner's turn to talk. Hey, you're going to have your turn. Don't interrupt right now. Really basic direction that you're giving. So what's always interesting is when one partner starts talking and they want to rely on the other person to help tell the story. That's really interesting too, because that kind of starts showing you some of their enmeshment, how they might not be able to fully access their own narrative without the other person's help. So there's all kinds of things you're looking for as you do this process wise, but then there's also the content of what you're getting from them. Someone's going to be like, I want to go first. You ask the first person, why are you here now? What particularly now brought you into couples therapy? What was the instigator? What was the moment? And if they give you a short answer, you want to ask deepening questions to hear a good narrative about why now. Often they'll just go off, but sometimes, especially some straight men, will be like, well, what she said. And then you need to cry and get deeper with them about how they're feeling about all of the things bringing them in. This next question is the most important question. And it's, what are you doing to contribute to the challenging dynamics between the two of you? This question is assessing for, are they able to own their own side of what's going on here? And it's really helpful to get this out of the way session one to see how skilled they are at knowing what they're doing, which is contributing to these dynamics. If they can't identify it, if they are going back to their partner's actions, if they can't just own what their own side of things are, that's your starting point, because that's huge. Like, you need to know at least some of the things you're doing that contribute to the challenging dynamics. So always interesting to hear the answer to that one. And if couples therapy is successful, what will your relationship look like in 6 months or a year once we've made progress? What does progress look like to you? And that one is really clarifying of, do they want to make the relationship better? Are they here to understand if they want to still be together? What does an ideal relationship look like for them? What do they want to improve? It's helping you understand where you're orienting as a therapist. So you do those three questions with both people as the other one sits silently. And then you indicate to them that you're done doing that thing. Now we can all talk again. And a lot of the time that takes up most of the intake session, but sometimes it goes faster. So I like to end with talking about how their sex life is, have them both weigh in on that. It's always good to get that out of the way also in the intake session, because you get them used to talking about sex right off the bat, which is a good pattern to get into, because you don't want to avoid sex as a couples therapist and then it's awkward for you to bring it up later. You want to just make it known that you're going to be able to talk about it and it's not going to be weird. Asking them how they first met. I don't always do that, but sometimes it's nice to, especially if, like, in those conversations you were just in, things got heated or rough. It's nice to ask how they first met and end on somewhat of a positive note like that. Then obviously you're going to tell them what their expectations are for therapy and that you're going to be doing individual sessions next. I end the session a lot of the time being like, here's my role. And I tell them everything I just told you guys prior to this slide. I'm going to be working a lot on containment, skill building, helping you to understand your patterns, helping you to be a better team. I might be directive sometimes. I might interact, all of that stuff. You tell them. So you're setting the expectation, and then you tell them that the next sessions are their individual intakes. And that's the first session. And it's like really relieving. It was really relieving to me to have that layout for a first session because when you're starting, it's obviously super anxiety provoking. So there's your first session schedule. Then within a week or two, you are going to do their individual sessions. These can be a normal 45, 50-minute session. You could do it longer. It's really up to you and how you do intakes. This is your chance to get to know each of them as an individual. So this is humongous because you need to establish trust and rapport with each person as an individual. You also need to screen for a lot of things in these individual sessions. So this is not optional either. If they're being weird and don't want to, one person's schedule is weird and, oh, could we just skip it and start? No, you both need an individual intake before we start couples therapy. You will be doing what you do as a therapist with your individual clients, which is establishing trust and rapport from this session onward. You're screening for domestic violence or other kinds of abuse. And importantly, I always start the session by saying, is there anything that you want to talk to me about one-on-one that's easier to talk to me about just the two of us rather than having your partner here? It's always nice when they're like, no, of course not. I can talk about anything. That's always nice when they're not taking out a book of all of the things that they want to tell you that their partner doesn't know about yet. Oh, I'm sorry. I have one more thing in the intake session before this session that you guys should know. And that is secrets. It's good to set the stage for these individual sessions by talking about your policy on secrets. I guess people call themselves no secrets therapists. I am a secrets therapist. I'm not encouraging secrets, but I do not want to be in the dark because their partner is. If someone cheated on their partner or someone has a gambling addiction or hasn't told them that they're thinking about a divorce, all of those things. It's so interesting to me because different couples therapists have different theories on this, but my theory is I want to know where you're at, and I can handle knowing that and not feeling like I'm betraying the other client by knowing something that they don't know. I can handle that. Some therapists, maybe you, don't want to do that. Like, you don't want to have this piece of information that the other person doesn't know. So a lot of therapists will say, I'm a no secrets therapist. If you tell me something, I'm going to encourage you to tell your partner about it. I don't know if it's just like my temperament or whatever. I find that I think it's simpler, but I don't think that it's necessarily better. I think that I could have a really interesting debate with someone who feels the opposite of me and probably learn a lot about that perspective. But essentially, you want to tell them in that couple session that you are whatever your secrets policy is. When I tell them that I'm not going to be a no secrets therapist, you can tell me something and I'm not going to go and run and tell your partner. I feel like it helps build trust, confidentiality, and it allows them to go into the individual sessions with a sense of protection and feeling like you're not there to be a tattletale. And I'm really not trying to make it sound like no secrets therapists are tattletales. Like that, that's really not it. I don't really understand that perspective. So that's maybe a limitation of me describing this to you right now. All that said, this is why when you get to the individual intake and you ask them, is there anything that you want to tell me about? Then they already know And you can remind them. I will not go and run and tell your partner if you don't want me to tell them that. A lot of the time, there's just no domestic violence, there's no abuse, there's nothing they want to bring up. And then you're just focusing on their history and their parents' relationship when they were a kid and how their parents related to them and all of the stuff that you would look at in a normal intake. But I think with more of a focus on relationships in their life. So, what was your mother loving? Was she cuddly? Was she playful? Was your dad there? Was he loving? Was he the primary caregiver? How was their relationship? What was their model for relationships growing up? How did they relate to their siblings? Did they feel alone as a kid? I always say my kind of question to start off the history is, can you describe your life to me when you're around 5 years old? I think 5 years old is an age where you're online, you can remember stuff. At least you know what things looked like and where you lived and what the general dynamics were. But it's young enough that you're still really super vulnerable and small. And so I think that's like a nice little vignette to get from them. And then you go up their developmental trajectory and you understand what their friendships looked like in high school and did they have their first relationship in high school. You want to hear about their dating history and their relationship history because you want to understand what their relationships looked like and what their patterns were prior to this partner. And you want to know what their relationships are like with their parents and their siblings and their friends now. So that's a lot. You're getting a lot of information from them, but the real focus and the through line and all of that is like, how do they relate to people? What are their relationship patterns? Are they a little isolated? Is their partner the only person that they truly have? Are they super involved with their family? What does that look like? What was their model for relationships? What did their previous relationships look like? It's all really good information for you. Any trauma history you will uncover in this. And it's always interesting to see how they talk about their own baggage and to hear what their narrative is about their life and how they describe it. I think a lot of people downplay how maybe lonely childhood was or how their parents did their best. A lot of people have that kind of narrative. A lot of people have a very established narrative about their trauma history and what that means for them. And so it's very like illuminating. This one, I like to ask about sex again, one on one, because sometimes it's just nothing different than what they told you together. Sometimes more will come out. So often this is where you're going to understand like desire discrepancies and what maybe one person wants that the other person doesn't, or what issues they've had sexually, their own sexual history previous to the relationship. And finally, you are really gauging their actual desire to be in and work on the relationship. Often in these individual sessions, you learn that the person doesn't, they're not really bought in. And they'll say that a lot more openly than they would in front of their partner. And so that's humongous. That's really important information. And ask about substance abuse or other addictions or porn. Think about all the things you would want to know about your individual clients, but especially looking at addictions and secret behaviors because those are often what we hide from our partners and ourselves. So you do want to screen for that too. Okay. So those are your first 3 sessions. So it's one couple session and then 2 individual. And then you start couples therapy. You've probably already figured this out based on your intake with them, but you are assessing more what their conflict style is and what their attachment styles are. The 2 main ones, there's a lot of nuance to this, and I know that there are more than 2 different kinds of couples, but I just want to break it down in a simple way for y'all and honestly just tell you how I see it in my experience, which is that There's the conflict avoidant couples, and there's the hostile dependent couples. And those all have plenty of umbrellas underneath them. Sometimes you'll get a secure couple, which is nice, but like these are the two main ones. And so you can usually tell which one they are pretty easily. There's an exercise that you can look up, and I'm not going to go into it right now a lot. I just don't want to train you guys on a completely other person's theory. But let me just tell you, if you go and Google the paper exercise couples therapy, the paper exercise couples therapy, you will find publicly this exercise that you can do with your couples. And it's what I do every session that comes after the individual sessions. I do the paper exercise and I do the pain list exercise. And I'll talk a little bit more about the pain list. But the paper exercise is interesting because it basically creates a little conflict for them and allows you to see in live time how they deal with it. I'm not going to go super into it right now. There are so many trainings and different things that I really encourage you to go look into it and see what people say about it. It's always fun to create a little dynamic and see how it plays out. That's the best way to see. Everything's a micro example of everything else, right? So if you create a completely meaningless conflict for them to have to deal with and then see how they do it, that's so much information for you. And it takes 5 minutes. And so I like to do that in the session, and I like to tell them what I'm seeing and tell them about what I'm noticing about how they communicate. The TLDR for this session that comes right after the individual sessions is you want to be assessing for stuff and you want to learn their main goals for this work. And it's your treatment planning session with them as a couple all together. One of the things that you can also do is a pain list exercise. And I can also share that resource. It's making a list of all the ways that you think that your partner's in pain. And it's essentially an inventory of all of the problems in the relationship. So it's a roadmap for you to understand what you're actually going to be working on content wise now at this point. And sorry if I'm being weird about these exercises. I think the reason that I don't want to just flat out tell you guys everything about them in this training is because I don't feel like it's like my training to run. And so that's the one thing that I will defer to the resources that are online about it. But all to say, like, this is very accessible to you, so you can go and find it. But I want to tell you what this session looks like from my perspective after I do these different exercises. When you create a little conflict and they do it in front of you, you get to see how they do conflict. Is it long? Is it like drawn out? Is it super short? They want to end it as soon as humanly possible. Do they get off track? Are they clear? Are they fair or unfair with each other? Boundaries are super interesting with this. How do they manage their boundaries? If someone has this opinion and someone has this opinion, does this person just change theirs when this person, how do they manage that? Are they able to self-define? So basically, the paper exercise is you tell them they have to hold a piece of paper in between the two of them, and one person has to get it at the end, and they can't rip it. And they each have to tell each other why they think that they should get it or why they think the other person should. So it's really interesting to see how they self-define, because are they even able to articulate why they think a certain thing, or are they just like trying to end the conflict ASAP? And that's really good information for you as a couples therapist. It's also fun to just do the paper exercise with people and to see it gives them, it's lighthearted. You're not doing a conflict about anything that's actually going on in their life. And so, in a way, it's like they're doing an activity together and you're getting to see how they do that. And then this kind of the same thing with the pain list exercise. You're each making this list of things that you do that cause the other person pain. You get to see, are they insightful about it? Are they completely missing the other person? You'll probably find that often couples know exactly what their issues are. They're not unaware. This whole session is a way for you to get insight into them. The other reason why I'm not going super into detail about what these exercises look like is I do think that they're imperfect and that they could be better. And so I would be curious if y'all went and read about the paper exercise and the pain list exercise, if you came up with your own versions of them that work better for you. I will send out a follow-up after this to just give you those resources. I just didn't want to waste a bunch of time teaching you really particular exercises that maybe may or may not be like the best thing to do. But essentially, they're assessment exercises and to see how they operate. And it's nice to have those as your third session too. I sometimes don't do them at all, which is the other reason why I don't want to preach that. Sometimes it's not the time to do that. With a couple that's conflict avoidant, it's honestly more interesting because you need to create a conflict to see how they even deal with it. With a hostile couple, sometimes I have to skip that entirely because they're so activated and in crisis that they can't even handle it. They can't do the paper exercise. So you got to see if, but like with the conflict avoidant couple, they will come in. It's so funny. Like a conflict avoidant couple will come in and they will sit there silently and they'll wait for you to tell them what to do. And this is the one day, if you have those exercises in your back pocket, that you can tell them what to do. From there, it is going to be on them. It just helps them out a little bit. It helps you pull things out of them. I'm going to talk about what's at the root of all of what you're doing and what are you going to explain to them about your approach if you do decide to adopt this developmental model approach. And then we'll talk about questions from there. And then like after that, we can talk about specific issues that come up and all the different ways that this looks in practice. So the developmental model is, again, it's the Couples Institute. It's what I was trained under. And it's essentially a nice little backbone theory for everything that you're doing with the couple. It is what it sounds like. Developmental model, you think about the development of probably a child, right? And that is essentially what this model is like. Your relationship is a child. The whole relationship itself is a small child that needs to grow up. And that's an interesting way to think about it. When I was getting trained on this model, they had so many documents and you could go and look them up and they wanted you to show them to your couples. And I like didn't like it because I felt like this felt patronizing to me. Here's how a child develops, and this is like what we're going to do with your relationship. I've found a way to describe this, which is how I'm describing it to you guys. That's a lot more in alignment with how I see it. But you could also go and read about exactly what they say about the developmental model. Essentially, what I say to clients is that your task is to help this little child grow up through the stages because the stages are predictable and we're going to work through the stages together to be a fully functional adult. And yes, you're helping the relationship grow, but you're also helping them grow as individuals. The kind of reckoning of this whole theory is learning that whether they're conflict avoidant or hostile dependent or whatever they are, they're usually a big blob. That's not their language, that's my language. And I like thinking about it as a big blob. Imagine a big blob in space, right? And it's shaking and having all these issues and it comes to you, the blob comes to you for therapy. And you're helping the blob separate into two smaller blobs that are then going to be able to, hopefully by the end of it, interact with each other and actually dance together. So they're not going to be bumping up against each other or having issues. They're going to hopefully be able to deal with each other, these two different blobs. So you guys can see me right now, right? Because I can't see me, so I don't know what everyone. Can they see me, Brittany? Maybe I'll just
Yes, we can see you.
I'll put myself full screen for a second. But like blob, separate two different blobs, and then like these two interact and dance. And so that's a big thing to reckon with is that idea that you are globbed with the other person and that a necessary task for you is to like separate in a way from that other person. It's not separate your marriage. That's not what it means. It's like you need to be able to like be an individual in order to be in a relationship. This is why it's so much like development because if you think about a little baby, when the baby comes out, the baby sees the world as this kind of everything is, we all learn this in Psych 101, everything is one thing. And then suddenly the baby starts to realize that it's its own thing and it's separate from its mom. It goes through these stages of learning how to be this independent agent. Essentially, you're helping this couple do the same thing with each other. Because Freudian, but it all comes down to this. We are all sort of these little children in relationships with their parents. There's some truth to that. And you're obviously playing it out in a different way and it looks different. And even if your relationship looks so different than your parents' relationship, you're still this pattern is pervasive across humanity. Like we're this flailing blob to start, and then we separate and we learn how to be an individual. So I like to describe it to them just like that. And that's because I like the word blob, but you guys might have your own way of deciding how you want to describe it. And at the end of the day, yes, there are like predictable stages of development, but also development's nonlinear and it's strange and it takes time and patience and consistency. And so you're encouraging them like, hey, you can do this, you can grow and you can go through these stages and you can make your relationship a fully functioning system. And we can help you do that. And it's going to take some time and it's going to take you showing up and really trying to do so. Because the blob theory is really just that we don't really know how to get out of that because no one really taught us how to. All of the love stories that you see, all the movies, most of them are like the lead up to becoming together and then they end with getting married and you live happily ever after. And that's it. And like you don't actually get to learn anything about what to do once you're living happily ever after. And so that's like where the blob starts. That's where you're coming in. And it's crazy because you could be meeting with a couple. Like I have met with couples who have been together for 40 years and they're still a blob. And they're a very ingrained blob because they've been doing it for 40 years. So no matter the stage of their relationship, whether it's 1 year in or 40 years in, you're still basically helping them get out of that. Now, this is like a really important and encouraging piece of information. The thing that feels really defeating about relationships is that you could be trying so hard and you feel like your partner's not meeting the mark or trying or putting in the same effort as you. And that feels like the stifling thing or the thing that's stopping you from growing. The really cool thing about this kind of systems developmental perspective on relationships is that it actually does not require both partners to change and grow. It doesn't act, and this is where it also relates to individual therapy, is one person in a system, one unit of a system changes its behavior, and the whole system has to change because of that. So when one person starts trying something different and breaking a pattern, it impacts the whole relationship. That's just how it goes. So this book, I put it up here, It Takes One to Tango. I really liked this book because it's like, wow, this is what I tell people like in the early stages of couples therapy. Like they'll complain about each other. They'll be like, he's not doing the thing and he's not doing the exercise. I'm like, you really don't need your partner to do any of this in order for you to grow this relationship and grow yourself. So it just takes all of the autonomy back for the individuals to know that they can work on this and they can grow their relationship and themselves and they don't actually need their partner's cooperation. It's great if they have it, but your goal isn't just to grow the relationship, it's to grow yourself and you can keep doing that whether or not your partner. So it's like the biggest blob trait is this sort of he does this and it makes me do this. Or they're everything feels enmeshed with each other so that they're stuck because their partner is doing this. It always like goes back to the other person. They can't differentiate, but you're really trying to help them do that. To be like, hey, you see this is a problem and you see this is a problem and you guys each can do this thing this week to work on that. And it doesn't even require the other person's cooperation. And that's humongous. It gives them a lot of agency back and it helps them feel less helpless because they realize, oh, they have power. They don't have to wait for the other person. And the cool thing about this book and this theory in general is, but you grow and then your partner does too. It's like modeling. And yeah, sometimes it doesn't work out and we'll talk about that, but it often does. When you change yourself, your partner does change too because they can't help it. They're in such close proximity to you. And ideally, they are a team at the end of it. But sometimes a team requires one person to really take the lead in order for the other players to show up and do their part. And so it takes one person really self-defining. I'm thinking about basketball. I don't know why my husband's really into basketball and I like listen to his podcast sometimes. Sometimes they build an entire basketball team around one player's skill. And that is one way to look at it is if one person's going to self-define faster than the other, fine. The team will still work around that. It really just brings the agency back to the individuals. And this differentiation is, like I said, glob going to two different globs. That's your first. And really, honestly, the developmental model goes into all these different stages of development. But if you can go from the blob to differentiated, that's most of the work that I see couples therapy doing. And I have worked with a few couples that have gone past that point, but they don't stay in therapy because at that point they can handle it. You know what I mean? So I think 95% of the time you're going to be working with couples that need to go from blob to differentiated. And I got this off Google. This is a Couples Institute, one of their many graphs of what it looks like to be less differentiated versus more. These are interesting to read through, and you guys can, again, access this stuff all on your own if you want to. But I think it can really help if you do want to present them with some materials to present them with some of the differentiation stuff because it gives you examples of what it looks like. For example, number 2, I assume I know what he or she wants based on what I want. That's like a very non-differentiated take. Number 11, I take actions that I know will help my partner feel more loved, appreciated, and valued. Like that you can really see the difference between blob versus two people. So yeah, that's the theory. And I feel like that opens up a lot of questions. So I want to pause there and just put this still to come. We're going to talk more about all of this stuff. So if I haven't hit on this yet, don't worry too much, but I'm curious what people are thinking about everything I've said so far.
Yeah, there's been a couple of questions in the
Okay.
chat, and a few have to do, one's from Karen, and it's regarding DV counseling. Karen, I don't know if you want to dive in or jump on just with your audio to go in deeper because to me, it looks like it's going to be a double question.
Yeah, I was just basically asking about, like, with my experience with domestic violence counseling, it's highly recommended not to suggest couples counseling because of safety issues.
Yeah.
And I did the group counseling for the men once they got out of jail, and we never recommended couples counseling. It was always individual counseling. So I wanted to know your thoughts about that.
Yeah, for sure. I probably should have put that in one of my earlier slides. I have all of my kind of don't continue therapy at the end, but no, you're right. So when I said in those individual sessions, I'm screening for DV, that it's a hard stop. You can't do couples therapy if domestic violence is happening. Or I would say even if other like verbal, financial, any kind of abuse is happening, because that is where the biggest potential for harm is, I would say. And yeah, so that is a referral out. And often for the person that you're finding out is the abused, you're giving them resources for if they need help with safety. And yeah, so you're absolutely on point with that. You can't do couples therapy with a couple in active domestic violence. And I think the other thing is if they say that used to be a problem and now isn't, that's still a hesitation and something you want to go really slowly and make sure you're really assessing for. I thankfully haven't had any couples that are like, we used to beat each other up, but now we don't. I know that happens, and I want to believe that those couples can benefit from couples therapy, but I do think that would be also like a pretty slippery slope. So, yeah, thank you for
Thank you.
pointing that
Thank
out.
you, Karen. Now we have a question from Lily. This is going to be about infidelity. So can you just outright ask about infidelity in your intakes, or do you wait for it to come up naturally?
Yeah, I should have also said that we have at Beacon an intake that I send out. It's like a history form that you get before they ever come to therapy, and that asks about infidelity. And you read through that in the same way you would with a client history form before your client comes in. So we'll share that. That gets sent out in advance so you do have a history and a narrative from both of them. And you can ask about it straight on. I think because I usually send out that intake form, I know what I'm coming into, so I don't always have to ask about that in particular, but also in that initial session, they will 9 times out of 10 that is coming up if it's a big issue that hasn't been resolved. So yeah, but it's not ever something you're avoiding bringing up.
And then the other questions we have are regarding the exercises. So Shelby, we will be sending over the exercises that we discussed earlier. We'll make sure everyone gets that link in my follow-up email as well.
Yeah. Just didn't want to like copyright infringe anything on this. Try not to get in trouble over here. Cool. But yes, I will send. I know that was a very vague part of my presentation.
Do we have any more questions before we continue? Feel free to unmute yourself. You don't have to show your screen, or just type them in the comment section and I can be able to read them off for you. And also give yourself a moment to take a break to go to the restroom, stretch, and grab something to eat at your desk.
Definitely. Hopefully
Okay.
y'all are like moving around off your cameras and not sitting still, because that's what I would be doing if I was on this training.
I know. Give yourself permission to get up if you need to. Okay, I think we are good on questions, and I will let you continue.
Okay, great. I'm gonna get myself a piece of gum now that we're talking about. So, yeah. I hope that overall what I've said so far has not scared people off. Because I know it sounds intense when you're summarizing it all in such rapid succession. But I guess one thing I will plug right now is I'm always laughing when it's appropriate. Like I try to always laugh when it's appropriate and lighten the mood. And that's like a huge part of all of this too. And yeah, you're not always going to be able to do that depending on the situation, but if you can bring some humor into each session, I really encourage it because it makes all of this a lot more bearable. Maybe even fun, which it can be. Okay. Sorry, let me get my gum like to a chewed place. This is a meme that I thought was funny. All of these memes that are in this presentation, most of them are I've just collected on my computer over the years, and now I finally have a place to put them. So I hope they're doing something for y'all. Okay. I'm going to talk a little bit more about hostile versus avoidant couples and what to do when you are working with them. You can tell by session 3 what kind of couple you're working with. Like I said, some of those assessment measures that I'm going to send out help you understand more nuance to that. They're going to sit silently or they're going to fight to the death. That's the dichotomy. It's very interesting how that works. And maybe one week it's one way and one week it's another. Sometimes they're both. So sometimes they're avoidant because they've been hostile with each other and they know how that goes. So then they avoid. So a lot of the time it can be a mixture between the two, but whoever's showing up to you that week, there's some ways to approach it that are helpful. Your role, no matter if they're hostile or avoidant, is to interrupt the pattern. So they're in a pattern and you're trying to get them out of that. So that looks very different for a hostile couple versus an avoidant couple, but your goal is the same, which is to get them out of that cycle. Whether they're hostile or avoidant, they are usually still a blob. I know when I was first learning about this stuff, it was a little bit hard to wrap my head around because I'm like, if they're avoiding each other, how are they a blob? Isn't that two different units? And the answer is no. And it's because you're often avoiding the other person because you don't want to upset them. You're avoiding because you don't want to rock the boat or rock the blob. You are avoiding because you don't know how to self-define. You don't know how to deal with conflict. And so it really does still come down to blob behavior. And the hostile couples, it's a lot easier to see the blob nature of them because they just come in and it's whoa, what am I looking at here? This is like a whole thing. And the other thing about the blob framing of it all, which I'm loving how many times I'm saying blob in this. I feel like I'm gonna have to write like some kind of my own theory, the blob theory. But you meet them as a couple at first, right, in your first session, and then you bring them out as individuals and you get to see how they act as individuals. And it's always so interesting because a lot of the time they are totally different when they're on their own versus together. And that's a lot of really good information if you notice that. So I think if you notice that they, as an individual, seem more confident, self-define better, or if you notice that they're pretty much the same, it tells you where they are in the differentiation stage. If they seem the same together as they are as individuals, that might indicate that they're a little bit further along. If they're like completely different as individuals than they are together, that's an indication that they're still very blob. Yeah, no matter if they're hostile or avoidant, the goal is the same. Again, interrupt the patterns, help them develop and grow as individuals and as a couple and as a system. Self-defining and untangling the knot. The way that this works is a lot of redirection to the self because with a hostile couple, I'll start with them. With the hostile couples, there's so much blaming and so much amorphous resentment and anger and so many ways that they trigger each other that you're often redirecting them back to their own experience and their own part in things, which is annoying to them. Like a hostile couple, I have to warn you, often if they're hostile to each other, they're going to be hostile to you because that's how they relate. You want to continually remind them that you're helping them by getting them off of what the other person's doing. And you want to help too. If this wife, which is a pretty common one, is upset because her husband doesn't ever help around the house and she feels like she's working full time and taking care of her kids and also doing all the dishes, and maybe he's more of the provider or whatever, or he's more absent, or maybe he's out in the yard doing tons of yard work. It's not like he's not doing his part, but he's not seeing her for what she's doing. She feels like she's carrying a big load. That's very common in hetero couples. It's really easy to fall into the trap of seeing the person who has all these like really obvious complaints that feel like, yeah, of course, if I was her, I would want my husband to do the dishes too. It's often easier to relate to one person's narrative on the situation. And that's a really important thing to remember when you're a couples therapist because it's still her fault. Like it's not about fault, it's not about blame. But at the end of the day, whatever pattern she's in, she still has an entire role in it. And you remembering to redirect them back to their own role in things is humongous for you not falling into the trap of, yeah, he does suck or whatever. You know what I mean? It's super important, especially when you find yourself really easily relating to one person's experience and not the others, to remember that person is in that relationship and is like an entire person in that relationship and helped create this dynamic. Whether it's a dynamic they say that they hate, they still are creating it actively with the other person. And so redirecting it back to themselves isn't to say that you think that the other person's behavior is right or unchangeable, but it's just to, again, bring the power back to them. And it helps you as a therapist to remember, don't fall into this trap of thinking that person's narrative about how the other person's the villain really, there's more to the story than that. So with hostile couples, you're doing a lot of that redirection. For avoidant couples, I really enjoy this work. This is the stuff that I feel like can be funny and it can be fun, is you're helping them identify what isn't working and voice that to each other and exposing them to voicing that to each other so that they can realize that they can get through it and it's not catastrophic. It's like exposure therapy for telling each other what they don't like about each other, literally, sometimes for some of these avoidant couples when they're really avoidant. And that can be more of a fun pattern interruption because you're trying to get them to tell each other what's wrong. And I really like that. I'll talk a little bit more about this in the next slide, but I have a system for helping avoidant couples get out of that pattern of never telling each other what's wrong. And that can be a little bit more of a fun pattern breaking. And then, like, for hostile couples, it's really taking responsibility for their side of it. And that's hard. Like, it's really hard. It's hard for all of us to do that. Even if we have a narrative around all the things that we do wrong, it's still really hard to change that. So I have a lot of compassion for the hostile couples because it doesn't feel good to be in that. And it doesn't feel good to be blaming another person for all of your problems. And at the end of the day, I believe that they're there because they want your help to get out of that. And so even if they think that you're annoying because you won't let them like finish a sentence or you keep telling them to go back to themselves and they feel, I think there's a delicate way to help them feel like they're being heard by you without falling into their trap of blaming the other person. And hostile couples, I think it is a lot more about the process, like I was saying to Dylan. But for avoidant couples, and for hostile couples, I use phone notes too. But for avoidant couples, the way that I usually have them start out is that I have them take phone notes early on about little mini nitpicky things that bothered them throughout the week. And this sounds like so antithetical to helping a couple. What are things that don't really matter that bother you? But it's actually really helpful for conflict avoidant couples because they need practice telling each other what's not working. And even if it's something really small that doesn't actually matter that much, like you didn't put the trash bag back in the trash when you took it out to the curb, or you brake too hard when you're driving, like whatever it is, those are things that it can be really hard for them to access. And so you telling them that's their homework and still be nitpicky of each other, it can be funny and it can get them out of the pattern of avoiding stuff. If they're hostile, you can help them use the phone notes to write down all of the things that they would have started a fight about but didn't. The phone notes are amazing because each one of them has a phone and I really encourage it to be the phone because I think people think that unless someone literally has a notebook with them at all times, like you always have your phone on you. And so it's really easy to just grab it and add something to a note. Yeah, with hostile couples, you could have them write down times that they held their tongue, arguments they didn't start. For both of them, you could have them write down appreciations in their phone notes, but that's a little bit easier to access later. Ideas for topics, that is more so an avoidant task is like the avoidant people will come to therapy and they'll be like, yeah, we had a good week. And that can be crazy making if you're a therapist. It's like that with individual clients too, but when a couple comes to you and they're like, yeah, things are pretty good right now, it can be a little annoying because you're like, what's going on? You know, that's not true. They're there because something's going on, but they might not even be able to put words to it. And so for avoidant couples, it can be helpful to tell them to write down ideas for topics. And this all sounds very content focused. You guys might be noticing these phone notes. These phone notes are very content focused. You need content to work on process. If you don't have any content, you won't have a process to work with, right? So it's not like the content doesn't matter. It's just like the instigator for you to help them with the process. So you do need topics and you need things that they're going to fight about. This one's funny, the things you did to help and want acknowledgement for. So I'm actually like, I'm a big proponent of telling your partner all the things that you did around the house or the things that you want their acknowledgement for. And it sounds funny, but like a lot of people feel really unappreciated in their relationships and they don't want to they don't want to come off needy or like they're bragging or making phone notes about all the things that they didn't get a thank you for. But I actually kind of like that practice because how hard is it for your to be like, hey, thank you so much for doing all of those things? It really isn't that hard. And it can go a huge way. And so I think when the people feel unappreciated, that can be like a really interesting phone note to make is what are all the things you did this week that you want some level of acknowledgement for? These are where you're, again, breaking patterns that these are kind of things that you wouldn't normally think to do. And so I'm trying to give people little assignments for the week that they might not normally think to do. Now, in terms of how to actually get stronger at all of the skills that you need to learn, this is like so this page right here, this gives you the content for what you're going to talk about in the session. This page is about the process of how you actually help them build skills using that content. And this is where process becomes the focus. I brought her up on this slide because she does a really beautiful, if you guys haven't seen that show Couples Therapy on Showtime, I really recommend watching 1 or 2 episodes or a full season of it because you can see how she does structured communication exercises in a way that feels so not formulaic. And like, this is where her skill really comes through is like, she'll be directing who needs to be talking at a certain time, but she won't really make it seem like she is. She'll be continually pulling each person in. She'll be stopping people when they're interrupting each other. She's helping them to know how to communicate with her little prompts. But there are ways to do that are a little bit more formulaic that can help a new couples therapist. And that would be like a communication exercise, such as the initiator inquirer exercise, which is basically when one person focuses on telling the other person what they want them to understand. And one person just listens, recaps, and tries to stay in their partner's experience, and then they switch roles. So that's another one that's like from the developmental model, and there's all kinds of documents about that you can find online, but that's one of so many different communication exercises that you can do. And the thing that these communication exercises are really doing is they're helping the people get used to regulating in the context of hard conversations. So it's really not, this is where it's really not about content because they're getting better at the process of doing it by working out. And so when we learned the initiator inquirer when I was training, something that I really liked that I keep in mind a lot and I sometimes tell clients is when we're working on these communication exercises, you could not resolve anything. I could cut you off at 7 minutes of just talking about this one topic, and it's still that was like lifting weights for 7 minutes. And so it's really not about getting anything resolved. It's about building the skill during that time that you're doing the communication exercise, building the skill of actively listening, of empathizing, of sharing without blaming. And I put this self-care for families up because this is other ways to work out your patterns and get better at doing all of these things day to day. I just kind of like this because I feel like there's all these different things that you could just look at this list and be like, here's what we're going to do right now. And you're building skills and you're building neural pathways in your brain to get yourself to do these things. And so it really doesn't matter what it is that you're doing or how you do a communication exercise, how you get them to communicate in a respectful way. It matters that they're trying and that you're helping them stay on track enough that it's not that they're not practicing skills you don't want them to have. So I think, Dylan, when I'm thinking about your question, it's like you can let them go as long as you see them getting stronger in skills that you want them to have. But as soon as you see them strengthening skills or neural networks that are not what you want, then you want to interrupt that. And it starts this is humongous. I think this is like one of my biggest take homes from all of this. It starts really small. So part of the like nitpicky phone note exercise is that you want to have small things to start working on these skills with. You want the pee on the toilet seat. You want the parking situation in the garage. You do not want the infidelity. You don't want the lack of sex in the relationship. Like, those are not small things to start building these skills around because those are too activating. You want to help people build up these skills of actively listening and communicating and really understanding and hearing each other in really small ways. And it's always so interesting when you can get them to have a structured communication around the pee on the toilet seat, because it always is deeper than that. And so they still get to see that even when they're trying to have kind of this goofy structured communication around pee on a toilet seat, they're still getting to the root of something. So that's where the content trap is like, you could start with anything and you're still going to get to the root of where these people are coming from and who they are and what they want the other person to understand. So they'll want to jump into the hard stuff right off the bat a lot of the time. Sometimes they won't. If they're hostile, they will. And it's really important not to let them do that. I think that's one of the pitfalls. And it's where containment can get hard because you don't want to tell them that their problems need to wait till later. But you also want them to have the skills to be able to have those conversations in ways that they haven't been able to before. So if you can psychoeducate them about how you're teaching them how to communicate so that they can have the conversation about the infidelity and really both be able to be present for that and handle it and stay in their window of tolerance, that's everything. There are lots of structured communication. I have found so many really great prompts and stuff like that just by Googling like couples therapy worksheets. I could send out a few of those that I have on my computer that I like to go to. The Initiator Inquirer is something you could look up and learn more about if you want to do that. Or you could watch couples therapy and see how Orna does it and see how that would look with your therapeutic style. I think when I say structured communication, it really is just that you're not letting them practice skills that you don't want them to get better at, essentially. So now, like, you've been doing that for a while. You've been trying to do all of these skills that I've been talking about. You've been seeing them, and sometimes it becomes clear that they're not actually really trying to work on the things that you're working on with them. I think that is true for individual clients as well. But it's always interesting to realize this as a couples therapist because you sometimes realize it before they do. And there's a few different like things that I've noticed when things aren't improving. And I just wanted to list these off. These are my experience, probably lots more. And I'm not trying to focus on like the negative clients that aren't changing, but it's just to say here's some common pitfalls that I've fallen into. They say that they're coming to couples therapy to work on stuff, but they actually just want to stay together as a blob and not really change much. But they just want to say that they're there at couples therapy. That's pretty common in individual therapy too. One or both of them do want to separate and have no idea how to do that. That can come up. This one happens a lot with hostile couples. They triangulate you and they bond due to their mutual decision that whatever your strategy or approach to this isn't working for them. That's not actually the worst thing. It often is pretty rooted in denial. But I've had that where like a hostile couple will come to me and I'll try to do all my things and they're like, she doesn't know anything. And then they leave. And then maybe they're closer after that. So sometimes that happens. Maybe you still help them. Or they really came to couples therapy with good intentions. They tried their very best. Things still aren't improving, or maybe they're getting worse. And they're in this holding pattern. And this is where I think you can fall into a holding pattern with them by accident, despite everything that I've talked about you're trying to do, because it's easy to do that with our individual clients as well. And this is probably the best of all those options that I just listed off, because they're still really trying. They're stuck, and you might be stuck with them. But with that all being said, I do want to put this out there because it's certainly happened to me as a couples therapist, and it's been heartbreaking in certain situations. But sometimes you do really good work, and they realize once they differentiate that they don't want to be together, that their values aren't in alignment, that they got together as high school sweethearts, but they really have never explored the world enough to confidently say they want to be together. Maybe one of them really wants kids. Maybe one of them wants to move. Like, maybe their kids moved out of the house and that was the only thing keeping them together. Like, it's not a failure as a couples therapist if you go through the process of doing this and you realize that your clients realize that they don't want to be together. And even if it's really sad, your goal isn't to keep them together always. Your goal is to help them get what they want out of life and stop being stuck in the pattern. So it's strange, but yeah, you're a couples therapist, and sometimes your work is helping people break up. I really like to think about relationships in general in terms of choosing every day to be together instead of defaulting because you chose that however long ago. And that's what I try to look at as the goal for when I'm working with a couple, like to really understand and help them understand why they want to be together and not just have that reason be because I don't want to get a divorce or because I don't want my kids to have divorced parents because we've already been together for so long. And like, you need a better reason to choose the other person every day, or you are going to be miserable and resentful. And so I really try to, and I try to do this in my own life with everything too, whether it's like a job or whatever it is, that I want to choose to be doing the thing I'm doing and not just be doing it because I started on that road and I don't know how to get off of it, or I'm afraid to get off of it. Because that's so common. It's really common that couples are together because they feel like they need to be, or they're afraid to really look at themselves truthfully. This comes up a lot in our supervision group, but yeah, I think I'm something I've been grappling with a lot recently with some of my couples is this idea of staying together for the kids. And I really have a lot of compassion for couples who do this, especially because I have a kid. And I now know that that's not just a BS thing. I mean, it is so disruptive to divorce, to separate. And when it's not like a domestic violence or abuse situation where it's very obvious that's the best thing for everybody, it's not always obvious that it is going to be the best thing to separate. But again, my goal for people isn't to help them realize that staying together for the kids is BS. It's like you need a bigger reason. You need a better and a bigger reason to stay together other than for the kids. Because if your whole life is like, and I have told people that I work with this, and I tell myself this all the time, is if you're not happy as an individual, you're modeling for your kids just being in an unhappy situation. And you want to model for your kids like being a fully individuated person and experiencing life the way that you want it. It's a really nuanced topic, especially on Cape Cod where it's so expensive to live. And if you don't have money, how do you even separate if you don't have money in a lot of situations? And then that's a really hard topic to come up against in therapy, is like when people just don't have the finances. But yeah, the whole staying together for the kids thing isn't always it. And helping people understand that they might be able to help if you're really seeing that they want to leave their partner and they're really just doing it for the kids, like helping them understand that they need a bigger reason if they really want to stay together than that. But sometimes people come to couples therapy to separate, and they might not even know that. I was trained in discernment counseling, which is, I really recommend it. I don't think it's crazy expensive to go and pay for yourself to go through the discernment counseling training. And if you are going to do couples therapy, I recommend it because when you're assessing in the first session for where they're at, you might find that they really are trying to understand if they want to get a divorce or not right off the bat, and they're at a breaking point. So this is a therapy that is really good for people who are at a breaking point because it's a lot more, again, structured. It helps them each self-define, understand what they're really like, leave no stone unturned, and feel a lot more confident about whatever decision. And you might work with a couple for a while and realize they need discernment counseling, and then you might refer them to someone. I don't know if everyone's even heard of this before, so I wanted to put it out there. Like, this is a thing. It's very helpful, and it is an option for people. You can refer people to discernment counselors, and you can get the training yourself if you want to. So that might be something that you need in your back pocket. But those are all the kind of worst case scenarios, I guess. Maybe not worst case scenarios. It's not a worst case scenario to divorce. Those are when the end goal isn't staying together. When the end goal is really staying together and making things work, which is the majority of the time, how do you know that things are getting better? The easiest way is that they actually report that they're making progress on their goals, and you can see it. It's not that they're not fighting anymore. It's sometimes it's that they are fighting now, which is a good thing because they were avoiding it all the time, but they can recover faster, and it's not catastrophic when they do get into fights. They are coming to therapy and telling you about ways that they resolved conflict over the week that didn't rely on you to help them get through that. And you're doing more reflecting on what they did and giving them props for it and asking what worked. You see that the skills have been built in empathy and all of the other communication skills. You might hit a plateau, which happens with individuals as well. And I think every time I've hit a plateau, I end up eventually doing a reassessment of what their goals are now. Because sometimes they do make progress on their goals or their goals change. And so you want to continually update their treatment plan in your head, not necessarily in documentation, or maybe in documentation, but you want to know what your plan is and be on the same page with them. They might say that they want to reduce to biweekly or monthly. And when you feel like that's a good idea, that's how you can know that some progress is being made. Sometimes people want to reduce to biweekly or monthly, just like individuals, where it's probably not a good idea, but you don't really have control over that. Yeah, and again, not ever fighting is not the goal. That's actually a red flag, I would say. Okay. Desire discrepancy is a very common issue. And I'm not a sex therapist, and I've thought a few times I should probably get more sex therapy training because I don't have a huge toolkit when it comes to sex issues, but I do have some things that I've learned. And with desire discrepancy, it's often helping them both understand their own sexual needs better. And that really just comes again down to self-defining. But it's a very nuanced topic. We'll talk more about sex on the next slide. But if there's trauma, if there's a history of lack of consent in the relationship, there are a lot of things to unpack. And so I would say there are a lot of ways that you can work on desire discrepancy without being a sex expert. And you might hit a wall with it, as I have with certain couples, and you might want to refer to a sex therapist. You have to see if they're communicating enough about it and if they're really able to both self-define and do all of the communication skills in this zone without getting feeling rejected or hurt or shut down or whatever. There's so many emotions that come with desire discrepancy because you feel rejected by your partner or you feel like your partner won't leave you alone. And so those are all things you can work with even if you don't have a huge vocabulary of sex therapy stuff. Infidelity, there are a lot of really great resources that I have leaned on for infidelity, but The State of Affairs by Esther Perel is the best book about it, in my opinion. And I recommend everybody working with a couple that has had infidelity or is still struggling with that, who's still actively struggling with it and getting over it, to read that book. And I do this with my couples where I will read books with them. I have The State of Affairs and I have the other Esther Perel book that Mating in Captivity. And having them read the book together and talk about the chapters, that's a great way to process stuff. It's almost like a book club with you and your clients. And I really recommend it, especially with Esther Perel books, because she's just such a genius. And she's also got podcasts and all kinds of other things. Mistrust goes hand in hand. Obviously, people have mistrust around all kinds of things, not just infidelity, but it really comes down to rebuilding something that's been broken. And in a lot of ways, infidelity and mistrust, you're reframing it as something came out and we can grow from this instead of this was devastating to our relationship. Now, there's also pathological liars. There's people who have been in relationships for 15 years and they've had the same issue with infidelity and mistrust the whole time. I'm not saying that's impossible to work with, but it's a lot easier to recover from a specific instance or set of instances, maybe like substance abuse, mistrust, or whatever, gambling, porn. If it's more isolated, I think when it's more pervasive across many years, that is like a lot harder to work on, especially because you don't really trust a client sometimes to not do the thing. That's something you have to work on in yourself as a therapist too. Do you trust this person to not do the thing that they're saying they're not going to do? So addiction is an interesting topic because I would say it's not like a screen out, a hard screen out like domestic violence is, but there are a lot of situations of addiction where you probably are better referring out. Obviously, if it's a narcotic addiction or something that's really harmful, that would be an obvious one. But alcohol is also a huge topic. I could probably do a 3-hour training just about alcoholism in relationships. But at the end of the day, when someone's alcohol addiction is really impacting their relationship because it's coming up all the time, you know when it's a problem when one person thinks their partner has an addiction and they don't think they do. And addiction is hard because it is a stunted, if you're looking at it through the developmental perspective, you're stuck at that developmental stage often until you can get the addiction under control. And so that is a situation where if one person's starting to develop and the other person's still stuck in their addiction, it can be hard because once two people get far off enough from each other where this person's this far along and this person's not, and often that's because of an addiction, this person's work is sometimes like, how am I going to decide to leave this person even though I love them? It sucks, but often you need to leave someone for them to hit rock bottom in order to get out of their addiction. Addiction is so complicated. My couples therapy supervisor at my last job said, when you're working with a couple who's like in active addiction, there really isn't much you can do until the addiction's under control. I don't know if I feel the same way about it because I look at things from like more of a harm reduction standpoint than that supervisor looked at things. And he was also in AA, so I think that makes sense. I think people in AA are really steadfast about abstinence is the only way because that's how it works a lot of the time with alcoholics. But with other addictions like behavioral addictions or eating disorders or porn or whatever, sex addiction, there is so much more nuance. And so I don't really agree that if a couple is dealing with an addiction issue that you can't help them. But I do think that might be a sign if you're feeling stunted, that's a big contributor. Parenting, finances, house chores, these are really common with married couples with kids. And finances is really hard because you can't help the problems that come from just not having enough money for stuff and a struggling. That's one of the hardest things when you're seeing two people trying so hard and you're seeing that they're struggling because it's just hard to live on their income. When it comes to parenting and finances and house chores, it really is like all of those ways that they fight, ways that they argue, ways that they hold resentment. Those are what you're trying to intervene on. Are you trying to help them understand how to have the same parenting philosophy? No. Are you trying to help them understand how to get a better job so they can make more money? No. Like you're not helping them. House chores, I will come back to because maybe sometimes you are giving them like really specific advice on those things, but like communicating about the parenting differences and the finances is really bring it back again to the process with those ones. That's the most classic process over content because they need to hear each other is what really needs to happen. And often the biggest issue is just that they're not listening and they think they're right and the other person's wrong. House chores. I think this one, I'm a big fan of chore charts and like even for adults, especially for adults, it's not a bad idea to have a system. It's not a bad idea to make your talk about desire discrepancy, to make your goal for the week. He takes initiative vacuuming and doing the dishes. The amount of times that helps with desire discrepancy is pretty nuts. So house chores, I think you can get more creative about because they're so tangible. It's not like infidelity where it's house chores a lot of the time are very tangible and doable. And that's why you can like really make it accessible for them. Hey, you can work on this. We can really do this. So sex does come up because you're working with couples and my biggest hack, I don't even think that it's situation specific. Mostly desire discrepancy is the situation that's coming up with it, but it could be a lot of things. Taking sex off the table really works. And it works even especially for the couples that think that it's not going to or really don't want to do that or are extremely resistant to it. It's if you can come up with a 1 month agreement that they're not going to have sex, they can do everything else, but they aren't going to have sex. It solves a lot of desire discrepancy stuff. It solves a lot of the I want to kiss you, but I don't want every time I kiss you for you to think that I'm trying to bang. There's so many ways that taking sex off the table really helps with a lot of those intimacy communication stuff. So it's helped so many couples I've worked with, and I just keep using it because of that. And I've told individual therapists to use that too when their clients are having sex issues in their relationship. It has to be mutually bought in, but I feel like it's really easy now for me to sell people on it because I'm like, I have seen this work. So you can use my anecdotes as an example. I think there's something about normalizing desire going in cycles, though, where everyone has a different amount of sex that they want to be having. And sometimes with hormones and life stages and kids and all of the stuff, it's normal to not have sex for 2 months and then to have sex a bunch 1 month. And then it doesn't have to be super consistent. People do like to schedule sex. Sometimes people like to do that. It's really a mixed bag. You could bring it up as an option and see how they respond to it. It's not my go-to. I feel like if sometimes people who are really busy and they both have the same desire, scheduling sex can work. I have a case example of a queer couple I've been working with in the last year, and they came to therapy because one of them really wanted to be having more sex. This is very common. They're having a ton of sex in the beginning and then they stop. And one person usually is the reason for that. And then they're not having sex anymore. And they're like, why isn't it like the beginning? This book, Mating in Captivity, really has a lot to say about that. But so with them, I started mating in captivity with them. They would go and read a chapter and we'd talk about it. Because one of the clients is the one who didn't really want to have sex anymore, was very shut down about talking about it also. This helps you give topics to talk about and stuff. But what the moral of the story is with them is that they came to therapy and their mutual goal was we want to solve this desire discrepancy issue. We want to have more sex. But it ended up coming out in the last 2 months after a year of working together that one of client who didn't want really to have sex anymore actually didn't have that goal. She thought she had the goal because her partner had the goal, but what her realization was like she might be on the asexual spectrum. And it takes a lot of bravery and self-reflection and stuff to actually come to that and to understand it. So I think that's just something to remember when it comes to working with people who have sex issues is they might think they have a goal and realize that wasn't their goal and that's not their desire. So keep that in mind. Everyone can change their goals and give them the permission to do that. I have worked with clients who have had sexual trauma in their history by accident. Honestly, I tend to screen out at least childhood sexual trauma for all my clients because I just don't feel equipped to handle that. But I have worked with one couple who they had a lot of really good communication about it and all of the issues that it brought up. But honestly, my kind of orientation towards all of that is if you see a big issue that you think is rooted in sexual trauma, I would refer to a sex therapist. I personally don't feel super comfortable or confident in my toolkit for that and my understanding of how that impacts someone's psyche. And I just think it's so complicated and deep. So don't feel bad if you have to refer out to a sex therapist. That might be the best thing for them. But there's also just like so many learning resources and ways that you can, this book right here, Sensate Focus and Sex Therapy, I've used a lot of those concepts when helping couples with, especially ones that like aren't good at embodiment and presence and being able to share what they actually like and what feels good or even know. That book is a really good resource. Sex is just a whole world and I can't really go into it in a lot of depth, but it will come up. So don't shy away from it. And in fact, maybe bring it up sooner than later. I've just noticed in my own relationship too that autism and ADHD people tend to find each other. ADHD and autistic people, I think they complement each other in a lot of ways. A lot of the ways that an ADHD person needs to be grounded. I know some people have both, but I see this a lot where one person has ADHD and the other has some kind of autism on the spectrum. I like working with those couples because I understand them, but it's also hard when ADHD, a person with ADHD has a high reactivity, a person with autism has a low emotional, usually vocabulary, able to like access what they're actually feeling. There's a little bit of an internal block of even knowing. The communication can be really fraught. And so I could talk more about that. I think I'm going to like just kind of leave that there because it could be a whole other talk. But all to say, you might see that a lot. And you might also notice that someone has spectrum traits when you're working with them and they don't realize it. I always think it's good to tell someone when I think that they might want to go get a neuropsych eval, or maybe you just tell them that they're seeing some of the traits of some kind of neurodivergence and let them know. I like to tell people what I'm seeing and not hold it in. People with trauma, you see a lot that people who have trauma are bringing that into their relationships. How could you not? But it's not an excuse for, I think a lot of people who have been traumatized do tend to be pretty controlling or manipulative, especially if they're trying to keep their life in control. It's not like they're trying to be that way, but that's just how that's like what they've learned. And I'm speaking from experience as someone who's been cheated on a lot. When you've been cheated on, you are going into your next relationship with trust issues. And there does need to be patience on the part of a person who's in a relationship with someone who has a trauma history like that. Often people's trauma histories are playing with each other. And I think it's really important to like be compassionate about people's trauma histories, but not let them use that as like a cop out and really take accountability for their own. It's another like locus of control thing where, yeah, you like want to bring the agency back to them to be able to really cope with that. I think something that's worth noting is processing styles, even just gender wise, but also with every person. Everyone processes the world completely differently. And I think a lot of us think that the way that we're processing a conversation or the world is just how the other person is. Because why wouldn't you think that? But a lot of people need time to process lots of information and can't necessarily always verbalize what they want to say and need to write it down first or need to think about it. And that can be a really big cause for arguments in relationships because often women process very quickly and have a zillion things going on in their head. And this is pretty heteronormative of me to talk about this, but I just see it often. So it's like I can't not call it out. Men often do need time. They need sometimes to not process verbally, they need to write stuff down, and they can't respond the way that their wife wants them to in the moment. And sometimes giving some psycho ed about that can be really helpful for people because they're like, oh, he's not just trying to stonewall me or ignore me. He actually can't get to where I want him to be. It's not like he's holding in exactly what he wants to say. He doesn't even know. That goes for everybody. It's not gendered, but I see that a lot in husband-wife dynamics in particular. Feelings wheels, writing, all of that kind of stuff are tools that you can give people who don't process as quickly or verbalize as well. And if you do have ADHD or you do have trauma, again, it's like you need to understand what that means for each other, but also always know that you can work on stuff and don't let your clients use their diagnosis as I'm just this way and I can't change because they can, everyone can. And there might be things that are really hard for them to work on, but if it's really important for their partner to work on something, they can work on it. I want to leave time for questions, so I think I'm going to skip through these last few slides, but this one I need to do. You might find when you're working with a couple that there is more going on than you realized at first, and it wasn't necessarily domestic violence that they reported at first, but maybe you're seeing some of that, or you're seeing emotional, verbal, financial abuse, manipulation. I have case examples. People in my supervision group know recent ones I've dealt with, and I have had to stop therapy and make behavior contracts with people to say, okay, I can't see you until you have 3 consistent months of not verbally abusing each other. And I haven't had any of those come back yet. I would happily take them back if they could really report to me that hasn't been happening. But there are red flags for when you need to pause, terminate, or refer out, especially like people who really are traumatized and need EMDR or a higher level of care. It's the same thing as referring out an individual, but with a couple, it can be, you can realize it after an amount of time that you didn't see something. And this is another reason why it's always good. Lauren asked this earlier. How often should you be doing individual check-ins? I would say in any situation that you feel like any of this could be going on, have more individual sessions because you want to be able to have them each feel comfortable to tell you what's really going on. The other last piece of it is like, you might just not be able to maintain a rapport with one of the clients, no matter how hard you try. And that's another indication they could probably use a referral out because you're not going to help a couple where one of the people thinks that you're just against them. So that doesn't happen that often, though. Okay. I want to leave time for questions. So yeah, thanks. Thanks everyone for
Thank
listening.
you so much, Felicia. We do have some questions that did appear. Oh, so sorry, the dogs are barking, but we did have some questions up here. One of the questions is about how do you structure the sessions? First session with the couple, then the next week, partner 1, then the next week, partner 2, then the couple again, and how do you structure that?
How do I structure it? Like you just said, like the first session is the 75-minute couple. Next 2 are the 2 50-minute individual. Next, you're back to couples. And ideally, you're starting weekly unless they just can't. And then you might be doing bi-weekly. What else do you mean about structure?
So Bridget is asking, basically, she's just trying to figure out
Oh, the codes and stuff.
the
Okay.
codes of how do you structure, and also individual intakes initially and not splitting it up that way moving forward?
Yeah.
You mentioned it earlier.
Yeah. So I can tell you how two different ways that I've seen it done. Probably the most straightforward way is just to have your set rate for a couple session and if for out-of-pocket people and have that be what you bill. But if you're billing for insurance, the couple center used to bill one of the client's insurances and add a fee on top of that. So as a therapist, you're getting paid your percentage of the, and it's a 90847. It's a family therapy code. And so that's how the couple center did it. And I've also seen it done that you could do two 90847s because a 75-minute session breaks out into 38 minutes and a 90847 is actually 23 minutes or more. I think that there's a little bit more. I don't know if that's correct, basically, is what I'm saying. I think that this is where the billing for it all is probably why people don't do couples therapy, to be honest, because the billing is confusing and people need to get compensated well for this. But a family therapy session pays less than a 90837. So it's like you're doing all this work and then you're not getting compensated fairly necessarily. So I think that's like, Bridget, I don't necessarily have a great answer for you because people do it different ways.
And Bridget, feel free to unmute yourself too if you have a follow-up question on that as well. Our next question is from Nicole, and it says, when you describe the relationship as a blob, are you referring to a codependent dynamic? What are you referring to?
I'm referring to a codependent dynamic, but it's not just that. It's you could be two very high functioning, independent people in the world and still be a blob and it's not a bad thing to be like most people are. And I think I certainly am still with my partner. There's a certain amount of not being able to fully operate in your relationship as a fully defined individual. That can look so many different ways. It can look like codependency. It can look like not ever being able to leave each other's side, having trust issues and not being able to work on those and being consumed by thought. I think when it comes down to it, if you are interested in reading more about the process of differentiation, it's really interesting because there's ways that you might think that you're being an individual and hyper independent where it's still deeply related to your relationship with your partner. And a lot of that can look like you don't have a lot of friends or supports outside of your relationship, or you, again, I think a really big tell for that is if you're doing their intake session as a couple and then you go to your individual sessions and they just seem like different. That is like a really easy tell. And it really comes down to like full recognition that they're each autonomous individuals who their behavior isn't, at the end of the day, it doesn't depend on the other person. It's just become that way because of how their relationship has gone and how basically everyone's relationship goes.
Thank you so much. And Bridget did say, yes, that makes a lot of sense. I think self-pay is much easier in that case. So thank you so much for sharing that.
Yeah, for sure.
Okay, before we end today's training, I just want to double check. Are there any more questions? Feel free to either unmute yourself or type it into the chat section so we can be able to address them before our call's over. And also while we wait, a few things that are going to come your way. It might actually come. Oh, did someone unmute themselves?
Yeah, Susan did.
Okay, Susan, there we are.
Hi, I have one question. Thank you. This was wonderful. I have two clients who are still together, have 25, 150, but there was infidelity, say 15, 20, 30 years ago, and they still is at the heart of their relationship after all these years. And any thoughts on that?
Yeah.
Or what advice you could have in working with them?
Yeah. For sure. I think that's really common is you see a couple who their whole relationship is defined by a moment that happened like 15 years ago and that they never actually processed through. And it's really common actually. And I think that the work is like the same with an infidelity as one that just happened, actually. The only difference is that you're probably hurting each other a lot more as that time goes by and you're not working through it. So there's probably a lot more resentment and ingrained patterns. But I think when it comes down to trust issues, what Esther Perel says, and I really do highly recommend if they haven't read that book that they should read it. And you could read it too with them. But what she says is that every infidelity, it's a very depth psychology approach to it because every infidelity is like the shadow of something that was wrong in your relationship coming out sideways, basically. And that it's not always devastating to the structure of the relationship for an infidelity to happen. Often it blows apart something that you needed to know to get to the next stage of closeness and communication. And so it's a symptom of a bigger issue. And I think your work as a therapist is figuring out what that bigger issue was all the way back then, and maybe even still is now. But there, like I said, if you look up like infidelity exercises and stuff like that, there's so many really good prompts that have to do with getting to the root of what was going on, what they weren't saying, what they weren't addressing back then. And if it's still that alive for them, I'm sure they can access that younger part of themselves and be pretty truthful with some help about what was really missing in their relationship.
Okay. Thank you.
Yeah.
Thank you. This is a great
Thank you,
training.
Susan.
Thank you so
Thanks.
much.
Thank you, Susan. Now we have another question, and it is, would you also share any great references that you have for sex therapists?
I actually don't have great references for sex therapists. I use, what is it called? There's this big, sorry, there's a big, if you look up sex therapy certification, there's a log of every person who's a certified sex therapist, and you can go by state, and that's what I use. I actually don't know any local sex therapists in particular. I have just used that and looked at people's insurances and stuff. And I would say use that and not like Psychology Today sex therapy, because that's going to be more reliable and they'll have, oh, thanks.
I
Yeah.
love this. I see all the, thank you so much. This is so helpful. Now, really quick, as I know people are jumping off the call, you will receive an email, and the email might come a little bit later because I want to make sure that we get all the resources from Felicia before we send that over to everyone. And also a replay if you were joining the call late because of our technical difficulties earlier. Thank you for your patience. We will get you a replay. And then for the individuals who are getting credit, we will send over a link for you to take your quiz so you can get your CEU credit. So outside of that, please note that you will receive your email again, probably a little bit later than we normally do for our trainings. And then if you have any questions, you can feel free to email myself or email Helen, and we can get anything you have addressed and taken care of. Okay, so I see a lot of stuff coming in. Olivia said, I learned so much. This has made it a lot easier, a lot better about starting. Also, there's Sarah. This was awesome. Oh my gosh, great. This is so great. I'm so happy that all of you were able to join us, especially with today's technical difficulties. We really appreciate you coming. So thank you, Lily. Thank you, Liv. Thank you, Olivia. Thank you, Sarah. Thank you, Dylan. I see everyone just coming on. So thank you all so much. Thank you, Felicia. That was amazing.
Thank you, Brittany.
I know, 3 hours too. I mean, I'd give it to you. No stop.
I like to yap. All right. Thanks, everybody.